one morning I woke up on Friday morning, May the 6th, I believe, woke up and my calf was swollen. And by Friday evening, the swelling had gone down into my ankle. And in the meantime, I started running a fever. And when it hit 102, then I called my other daughter and asked her to take me to the hospital. At which time, when I got to Good Sam, they diagnosed me as having cellulitis and congestive heart failure. Once I got off IVs from the antibiotics and heart medication and so forth, then I was dismissed to Dayton Rehab Center. And I was there for almost 2 weeks, maybe 10 days to 2 weeks. And finally dismissed from there. And at that time, they put an Uno boot on my foot, and that's a bandage saturated with medicine. And that was placed on this wound on my foot, the open cellulitis. And that was hopefully to have cured the, or to help cure, I guess, some of the germs left in the cellulitis, or the drainage and so forth. And that was the time when I was assigned a visiting nurse from Fidelity. And so Lynn, I believe, was the wound care nurse who came Tuesday. And once she started unwrapping, well, she noticed from the drainage and the odor, she said something's not right. And the more she unwrapped, the worse she said, you need to go to ER right now. So she sent me to Miami Valley's ER. And the next day I met Dr. Perry and Dr. Wonderlift. And they confirmed, it was a severe infection. And if it had not been for Kathy and Linda, I probably wouldn't have my foot today. And so between the two men, Dr. Perry and Dr. Wonderlift, they did debridement, and I have a wound vac on now, and that's a pump that's sucking out the drainage plus bringing up the good tissue, to prepare my foot for a skin grafting. And then since I've been here, I've had a daily wrap that needs to be changed every 12 hours. And Teresa's been one of your nurses, has come here every 12 hours changing the bandage. And I have nothing but praises for your staff. But back to Kathy and Linda, I'm grateful I have my foot because of those two ladies.